next coming to the RTA. So normal thing we see is bones coming out and a lot of bleed.
Yes.
So what should be done when they see the bone outside or a lot of bleeding is there? So what's the first aid to be done in that case?
Road traffic accidents, we call it as RTA, road traffic accidents. There are three types of ways the person dies. Okay, the three modes of time, like instantaneous death. Instantaneous, the minute you meet with an accident, you die there in the scene. It is most likely because rupture of your great vessels, like bigger blood vessels, they rupture and bleed, and you die immediately. Or you have major loss of brain, the spinal cord break or brain damage, brain coming out, stomach coming out. See, again, the amount of damage depends on what speed you were and how you met with an accident, like from the side, from back, from front, from above, from below, or how you were sitting with seat belt, without seat belt, or with a helmet, without a helmet. So depends on what protection you are wearing, what precautions you are taking, how much speed you were, and where you were sitting, front of the car, back of the car, or in the middle of the car. What things were you around you which were causing compression or damage to you. So the damage to assess in every RTA is very different, because every accident is unique and no two injuries are same, no two persons are same. So each and every injury, each and every accident should be taken in a unique way and it dealt with in a unique way. So as you said, yes, when the person is meeting with the accident, the first way of dying is instantaneous death, where these major organs get ruptured or injured. They'll die immediately. And the third way, I'm skipping the second way because I'll come to the second way. It's a big explanation to give. Third way of dying is because once you survive the accident spot, you go to the hospital, you get treated, and you get healed. But because of the injuries which you have occurred, you might be bedridden or not bedridden or something, you lose your limb or something, and then you get infections secondary to the injuries.
Okay.
So that will kill you as a third cause. Okay. First cause is by instantaneous death. Third cause is by the later time where you suffer with injuries and infections. So, and the second, which is again the most preventable way of death for accidents, is the golden hour death. So, there are certain causes in trauma can be treated in the first 1 hour of the accident, which that's why called as golden hour. If in this time, if the person is taken to the hospital and those life threatening injuries can be identified and treated, the patient will live.
Okay.
The patient will live. Okay, so that is the reason this golden hour is very important. So the minute he meets with an accident, you have to take him to the hospital within the 1 hour. If there is any major things, we can treat the patient, he will be living. That's called golden hour. So please remember, yes, if the person meets with an accident, yes, you need to take him to the hospital as soon as possible. Okay, but there are many precautions to be taken here. As you said, bone comes out, he starts bleeding. Some people have fear of touching the blood. They get giddiness and they fall down when they see the blood. But doesn't matter. So the diseases which are in the blood cannot be transmitted to you just because you are touching him. If you are afraid, you can wear gloves, you can wear cloth, you can touch with that cloth. Okay, it can be wiped off, it can be cleaned off at a later time. Unless your blood touches his blood, usually the diseases don't transmit each other. But the naked skin, no, it doesn't come in that way.
Yes, skin is one of the greatest
barrier. Yes, skin is the best barrier for you to get diseases from outside. And most of the diseases which are there in the blood, once they are exposed to the outside environment, they don't usually live. Okay, the blood is continuously flowing, so they don't usually live. So don't get afraid that, okay, well, I might contract disease, especially AIDS, all these viruses. Yes, we tell them don't directly touch the blood, but still in a life-threatening situation, please go ahead and help them. Don't think in that way. That person may be 1 in 1,000 or 1 in 10,000, but if you save the other 999, it's still okay, right? So it's okay. Everything we have treatment and other things. Don't be afraid to touch the blood and so. Now, what can I do is what your question is. Yes. Always estimate the speed of the injury. What was the position? What is the position he is lying in? If you think that there is a spinal cord injury, the spinal cord is where from here to here your backbone. If you think that that is injured, so you should not mishandle him. When I say mishandle him, don't try to manipulate his head or try to lift him with limbs and then do it. No, just turn him aside, put a wooden plank behind, and then put him on that, and then start carrying the plank from then on. Okay, that is the way you have to move the patient when you are suspecting a backbone injury. The best way of thing to do is to get an ambulance faster, and then they know how to transport a patient. They know they're trained technicians, they're trained nurses in the ambulances, drivers. They try to move him in a safest way possible. Again, if the patient is conscious, transporting him safe is more important, as important as
Treatment.
faster.
Okay.
Faster transport. Both are equally important.
Okay.
So you can't tell that he is wasting time by putting this. No, they are very important. Putting a collar is important. Putting a spine board is important. Putting a wrapping with Velcro tapes is important. Securing him is as important as transporting him as faster. Both will save the patient. You try to be fast and damage his organs in the way, doesn't make the patient live. You'll only brought him faster, that's all. But safe and faster is always the preferred mode. That's why ambulances are the best ones to transport a patient of trauma. But in Indian scenario, the fastest transportation mode is autos.
Okay.
So when I worked with many institutions, I trained almost like 500 to 1000 auto drivers in this first aid, so that we know that they are the people who are bringing to our emergency the accident cases. We tell them this is the precautions you take, this is the precautions, and then they were very enthusiastic. They learned also. And when you said that when the bone break and it is looking outside, okay. So one of the ways where the person dies in a heart accident in the first 1 hour is by bleeding. It can be external bleeding or internal bleeding. So that is the reason we ask you to bring the patient to hospital faster. So if it is an external bleeding, so all you can do is just put pressure on the wound. Stop the bleeding somehow. Okay. Apply a splint. The minute you immobilize the bone, whatever the blood which has come out becomes a clot and stops further bleeding. It's called tamponade effect.
Okay.
Okay. So try to stop the bleeding by direct pressure. Wherever it is, you can just apply direct pressure. Like if there is a can or a water, oil which is leaking, what you do, just put a finger on the hole so that it doesn't stops leaking. It's the same. Put a direct pressure on the bleeder, but it will stop bleeding. That's the first thing. That means half of the thing you have already done to save the patient. Okay, so stop the bleeder. Now make the limb straight if possible. If it is not, just splint it in the way it is. Further, it doesn't move and cause pain. If you splint a limb or hand, whatever it is, pain comes down, bleeding comes down. It easy for transportation. So that's why splinting is very important. Splinting can be many ways. If you don't have a formal splint of which we hospitals use, you can take it straight wooden planks or logs there, to put two together and tie it with a rope.
Okay.
Not too tight, as I told you, not too tight that circulation is stopped, but tight enough for the limb to be immobilized. Okay, so in these ways you can do it. If you are afraid of the bleeding blood, then wrap the limb with a blanket or a bed sheet or a towel or something where you don't have direct sight, and then transport him, so that at least you will have a feeling that okay, I did not touch blood and all. Okay, but as I said, blood like that will not transmit diseases just in like that. We don't see such kind of diseases yet. And transporting within 1 hour and a safe transport is always mandatory for accidents. Always be careful of the spinal cord, and if the patient is actually life threatening and gasping, then forget about the spinal cord, but just let him take to the hospital. Is also we try to tell people. But safe transport is always efficient. And believe me, I have treated thousands of trauma patients in my emergency, and getting him safe and faster way, we have given very good quality of life to them after healing. Most of the time, accidents, not only the person, sir, I'm telling you, the whole family gets affected, and you don't know the cost of treatment they undergo, the bedridden patients, and it's a lot of pain to the family. And usually the people who are transported are also the breadwinners, family breadwinners, and if they are getting affected, the whole family gets affected. So my suggestion to all of you, when you hear all these things, Disease session is given to make you aware of the situations and do a prevention and know the first aid, not to scare you, but to make you give more information that you, so that you can be more preventive, you can prevent these things. And one more suggestion I can give you is have health insurance, ample amount, because in future the treatments cost is going to go up. Even though Prime Minister has promised Ayushman Bhav and we have Arogyasri, all these schemes, and they will be little out of reach, or may not be covering all the illnesses what you have, and they may be covered only in the government hospitals, where the time taken for the treatment may be little more than what we can expect. So having health insurance doesn't hurt, is what I feel, and I've seen many patients who are actually benefited with taking health insurance than non-benefited with the health insurance. So that is one suggestion I can give.
Yeah. Thank you, sir.